Hey guys, this is Connor with Conquest HP, and I have some bad news for you. Your hips are definitely misaligned. Definitely. And I have some good news for you, which is that hip misalignment doesn't necessarily matter. Maybe not at all. Maybe not at all for you. But hip misalignment is an incredibly common thing. It might be as common can be. It might be something that we all have to some degree, and there's nothing wrong with that. A lot of people will lay down on a chiros table or an osteopath's table or a physio table today, and they'll have the practitioner kind of palpate around the hips, and they'll have that practitioner tell them, oh man, these hips are crooked. You are so misaligned. Wow, this is bad. And that poor patient is going to be scared to death that this is a serious problem, that this hip misalignment is going to cause some serious pain, or it's going to lead to osteoarthritis, or it's something that they can't fix, and that their only way to work on it is by seeing this practitioner, and it's going to mean they can't do the things they want to do. This is terrible. We need to do better than this. This is as a therapist, as a manual osteopath, we need to do better than this. The person on the table deserves better than that. That is trash. Uh, Hip misalignment is something we all have, and you know why we have it. It's because our pelvis is meant to move. You are not symmetrical. Your organs aren't symmetrical. Your body is not ever going to be symmetrical. Just deal with that. In your pelvis, which is what we're looking at when we say hip misalignment, it's even the term is a misnomer. Your pelvis is meant to move. Okay, so every time you're walking, your pelvis is kind of like this. It's shifting back and forth. It's hiking back and forth from side to side. It's rotating. It's meant to move. Okay, every time you sit down in a chair and get back up from that chair, everything's going all over the place. Okay, so am I supposed to, as a practitioner, or are you supposed to, as the patient, take a snapshot of any one of those positions and say, see, misaligned? If you come into my office and you come in to see me and you're worried that you have hip misalignment, there's a number of ways I can look at this. Okay, so I might have you do a standing posture test where I check out the position of your pelvis and I try to see if the hips are hiked up on one side, or it's rotated further forward on one side or further back, or rotated, or whatever. I might do the same thing with you lying down on the table. I might pull your feet lengthwise and then check out the position of your hips. Patients I've had in the past will know that this is something I do. I still do this today. I do it because I'm gathering data points. I want to know how something appears. But suppose I look at your hip position as you're standing there, or as you're laying on the table, and I say, these things are crooked. I'm surprised this isn't causing a whole bunch of pain. And then I close my eyes and you lift your butt off the table and shift over to the side and put your butt back down, and I open my eyes and I check for your hip alignment again, and I say, oh, that's weird. I could have swore that they were aligned the other way a minute ago, and now they're aligned this way. That actually happens. Okay, that is actually what will happen. If you, in that lying position, when you're laying on your back, if you change your hip orientation, that is going to change the way your hip alignment looks. If I'm trying to test to see if your hip bones are moving equally from side to side, and you're slightly laying on one side more than the other, that changes the way your hip mobility looks, your pelvis mobility looks. It absolutely changes it. It changes the muscle tone around your pelvis. So same thing standing. If you're standing and you're perfectly upright as you can be, maybe it looks one way, and then you stand the way you stand with your friends, where you kind of kick your hip out to the side. That's totally different alignment. Are we going to call that misalignment now? Are you supposed to never move from this fairy tale perfect alignment? No. First of all, it doesn't exist, and second of all, who cares, right? Like, why? If you get to that perfect alignment and you're just frozen there for all time, would that feel better? No, it would not, because anytime you freeze anything in any place, it tends to hurt more. If you move it a bit more, it tends to feel better. But hip misalignment, or rather, hip alignment, hip symmetry, is like this fairy tale creature that many therapists are going to push, as though it's an attainable goal or a target we need to shoot for, or the reason that you have pain is because you're not aligned, and I can align you. That's convenient, right? If we look at it that way, you are just dangling a carrot in front of a horse, and that carrot will always be there, and you're always going to plant this idea in your patient's mind that there's something wrong with them that isn't totally within their control, and they need your help to fix it. And I am struggling to think of something that is less ethical than that. That is, I'm getting a little disgusted as I'm talking about it. I can feel it. But what are our alternatives? Because if you lay down on my table and I check the position of your hips, I'm a human being. There's room for error there. My hands aren't perfect. Your hips aren't perfect. So can I just tell every client that I see your hips are perfectly aligned, or this doesn't matter for anything? No, I'm not going to say that, because that's not the truth either. So you can have this hip misalignment as close to hip alignment as I can possibly measure. You can have this alignment issue, but it only ever matters in the context of how does it affect you. Does it show up in your day-to-day life? Is it affecting your strength, your mobility? Is it causing, or does it seem to be causing back pain or hip pain or something like that? If it isn't, you should consider working on it or looking for it, but don't worry about it. Don't worry about being perfectly symmetrical. Now, most people that come in to see me are going to have a hip ache or a back ache or something. That's why they come to see me, right? So if I find that they're laying on my table and they have way more tension in their lower back and in their hip muscles on the left side than they do on the right, I'm going to pay attention to that, especially if they have pain on that side. And that is, at the end of the day, my job. And as far as I'm concerned, your job as the patient is to try to find these factors and address them. So we always use that filter. We're always filtering every question through that overall context of how does this affect you in your day-to-day life. If you come in and you say, my hips, my back, my legs, everything feels great, I feel great, and I tell you you're misaligned, you should not care. Okay, you should not care. You should say, oh, how's that showing up? Now, is that something I should be concerned about? But you shouldn't think immediately that it's going to cause pain. Absolutely not. If you come in and you have back pain on one side, in your lower back and in your upper hip on one side, but not the other side, and it seems as though you're hiking your hip up on that side a little bit, and the soft tissues around that hip, around that hiked up hip, have tightened up on one side compared to the other side. This is important to understand. This does not mean that those specific musculoskeletal changes are causing your pain, but my job as a therapist is to look at all of the possible factors that might contribute to your pain, which is the problem you came to me with, and address as many of them as I can. So if you have a whole bunch of unnecessary tension around that painful spot or on that hip, maybe that's something we want to address. Maybe with my hands-on techniques, I'm going to loosen that up. Maybe I'm going to show you stretches or show you some way to release it on your own. Maybe I'm going to give you strengthening exercises to make sure that that tension doesn't come back. This is just a hypothesis. Okay, you came into me with a problem, you have pain. I can look at that area and say, you know what, it looks like there's some extra tension here. It's possible, don't you agree, that this tension might contribute in some way to your pain? Do you think we should try addressing the tension and seeing if that changes anything? And if we look at it like that, it's pretty reasonable to say, you know what, yeah, let's what the heck, that's one of the factors on our list that might contribute to your pain. Let's see what happens if we get rid of it. And then we go about getting rid of it, because that's a tangible goal. And then we measure later, did this help with pain? Did this not help with pain? And in many cases it does help with pain, but that's kind of beside the point. So the hip misalignment in and of itself is not the problem. You have some symptom. That is our core problem. We look for factors that might contribute to that problem. We address those factors. Hip misalignment might be a symptom in and of itself. Maybe that hip is sitting a little higher on one side compared to the other because you strained a muscle in your lower back and it's pulling up on that side. Maybe that's interesting information for us to use and to act on. But it always comes back to this context of how is it affecting you in your day and what do we need to do about it. If you're feeling great and it seems as though you have relatively similar strength and mobility from side to side in your hips, do we need to look at hip misalignment? I would challenge chiros and physios and osteos and massage therapists to provide any point that we should. If there's similar strength and similar mobility and similar function from one side to the other, and then you lay down on the table and then it looks like you're misaligned, do we still care? Personally, I don't care, because you can shift your posture and look misaligned the other way, or you can stand up and you'll have different alignment. It doesn't really matter. Okay, so we're looking for factors that can affect the quality of your life. If you have a problem, we're going to look for those discrepancies. Is there more tension on one side? Does one side have less mobility or less strength or whatever? If there are those factors, we can work on them. We can try to improve those things. The goal to improve those things is a great goal. And after we improve them, we can assess whether or not they helped with symptoms. And if they didn't, we can explore other factors. But it always comes back to that. And if you have similar strength and similar mobility and similar function from side to side, hip misalignment is not a sentence you have to care about. It's not a term that has to determine how you live your life. You don't necessarily have to change your favorite posture to a slightly different posture just because your hips are slightly misaligned. If it's not affecting you in any meaningful way and you still have adequate strength and mobility on each side, who cares? So really this comes back to something that has happened for years in the health professional, in professional health professions, I guess. It's just a term that's thrown out, and it's kind of thrown out callously, like, oh yeah, it's a nice sunny day, and oh, how are your kids? Oh, your hips are super crooked, right? It's just thrown in there. And I think as practitioners, what we need to do is realize the impact it's having on the people that we're talking to, because these are people. It's not just a set of hips sitting on your table that you can just remark at and make fun of for being crooked or whatever. They are taking this, and maybe you're one of these patients. You may not necessarily understand what that alignment means. You don't know what it means in a physical sense. Does it mean there's a rotation difference, or it's hiking up on one side or the other? You don't even know that. Do you know if it's going to cause symptoms or not? These are things that as a patient you're afraid of, and you don't need to be afraid of it. Okay? Bring it back to the concrete things. Are you feeling a difference from day to day? Is it affecting you from day to day? Is there a strength or mobility difference? Is there a stability difference? Is there something tangible there that you can actually worry about, and should you worry about it? Bring it back to that. Bring it back to something concrete and measurable, and then go from there. And if there are differences, that's great news. Work on them. It's always good to find things to work on like that. That's low-hanging fruit, easy explanations for our problems. We should all be so lucky to find easy explanations for problems like that, especially if those problems include pain. So you can tell I get a little bit fired up about this, but this is something that absolutely needs to change among manual osteopaths, among physios. We need to stop being so callous with that term. And if you're just someone looking to improve your health or your fitness or whatever it may be, take that term hip misalignment with a grain of salt. Having perfectly symmetrical hips is not a reasonable goal. It's not a realistic goal. Nor would having perfectly symmetrical hips even allow you to move throughout the day, because they're going to have to change positions to get you throughout the day. So don't work any harder for this than you would for a pet unicorn, and that's what I'm going to leave you with. And if there are discrepancies there, by all means, work on them. So I'd love to hear your thoughts about this. Leave me a comment below if you're watching this on YouTube or Facebook or wherever you may be seeing it. And I'll talk to you guys again soon.